Hello, myself Haridas Mukhar, and today our presentation topic is electrocardiogram (ECG), detection of ALPX. Uh, basically, ECG records the electric activity of our hearts from electrodes placed on the skin in the specific location. Here is our content. Uh, Firstly, introduction, literature review, need of the study, research design, data collection and procedure, analysis of methodology from the signal processing point of view, findings, and the conclusion. Moves toward the introduction part. Let's introduce the ECG. The ECG, the accuracy of the analysis usually depends on the quality of the input which we are taking to the ECG signal. ECG signals are form of P waves, QRS complex, T waves. Signal can be analyzed and processed into two domains, time domain and the frequency domain. That's shown in the next slide. Here we can see the placement of the ECG electrode on our chest, and here is the diagram of ECG. Moves toward the literature survey. We review the two papers. The first one is the design and simulation of low pass filter. The we in the first paper uh, the filter are used to achieve spikes free signals in the and ECG signal filter by 2 IR filter. The first one is Butterworth and second one is the Chebyshev. In the second literature review, second paper is they are using the EEG. The full form of EEG is electroencephalogram. It's record the electric activity of the brain. Need for the study. In some case, it can be important to get this test. Such a risky factors such as high blood pressure or symptoms of heart disease such as heart pain, shortage of breath. And it's a common and painless test used to quickly detect heart problem and monitor your heart health. Moves toward the research design. There are three main components to an ECG. Firstly, the P wave, which represents the depolarization of arteria. The QRS complex, which represents the depolarization of the ventricles, and the T wave, which represents the repolarization of the ventricles. The overall magnitude of the Hertz electrically potential is then measured from 12 different ways and is recorded over a period of time. And we are using the two filters. The first one is high pass and the low pass filter. Here we can see the research design from the human where we place the electron. We can take the signal and using the instrumentation amplifier we can amplify the signal, and using band pass filter. The band pass filter is made up from the high pass filter and the low pass filter. The low pass filter is used to remove high frequency, and the high pass filter removes low frequency components such as motion, respiratory variation, and the baseline. And we give the notch filter frequency about to 60 hertz, and with the help of ADC we can convert it into the signals. Moving toward data collection and procedure of collecting data. The first one, we have to remove the low frequency component, and in that we changes frequency domain using FFT. Second one is the low frequency component. We have to remove low frequency component using the high pass filter. Finding local maxima using window filter. Uh, there are several methods. There are several methods using Windows method. Uh, Remove small walls, store significant one, and the last one is adjust the filter size and repeat 2 or 3 times to get linear graph which we can see the R peak very easily. Here is analysis of methodology from the signal processing point of view. The first graph shows the input we are taking, and the second is we are removing the low frequency component. Here is after the Windows filter, we can see the first figure, and uh, the fourth figure is thresholding. It is the implementation in the MATLAB. Here is the R peak detection in the MATLAB. Generally, it is the noise corrupted ECG signal. Here is our final output. Here we can see that there are various uh, R peak detection in the first figure, and the another figure is the ECG signal which we are taking as the input and converting into the various FFT and then filter. Here is the findings. We are finding the R peaks. So the formula for finding the rate is 60 into sampling rate divided by RR intervals. The RR interval is the samples between first R peak to the repeated R peak. Moving toward the conclusion. The purpose of this presentation is finding an optimal combination of several introduced algorithms for detection of R peak in order to achieve the better result, accuracy, and especially in noisy environment. Using the high pass filter and the low pass filter, we can detect our heart rate with the help of MATLAB without the using ECG. Thank you.